New information on how the H1N1 vaccine will be doled out. Beginning late next month, vaccines for H1N1 will be distributed from 4 regional warehouses all around the country. The vaccines are expected to reach 20 million doses a week by the end of October and will be dispersed among 90,000 providers, including health departments, hospitals, and doctors' offices. An additional 3.4 million doses of an H1N1 nasal spray vaccine for people ages 2 to 49 will become available starting in early October. And knowing that the H1N1 virus is out there, the vaccine and the virus will soon both be out there, the question surfaces, has there been enough time and testing to make sure that a vaccine is safe? Joining us now for a fair and balanced debate is board-certified internist Dr. Svetlana Kogan and also Dr. Chris Camilleri from the Holtroff Medical Group. We thank you both for joining us. Dr. Kogan, let me start with you. This is a live vaccine. Explain what that means.
Okay, here's a little crash course in immunology, guys. We have 2 types of vaccines we're giving to people. One is a live attenuated vaccine, for example, like measles, mumps, rubella. And that's the one that pertains many of the complications and side effects. In fact, there's been a lot of debate recently about the possible connection with autism in relation to the measles, mumps, rubella, live vaccines. Now, we have a second group of vaccines which are much more common, and that's the killed inactivated vaccine. That's the usual influenza vaccine we're used to giving in our doctor's offices every year for regular human influenza virus. So the basic difference between the 2 vaccines is the complication rate, the side effect rate. You cannot give the live vaccine to children younger than 2 years of age, and that poses a lot of issues because those kids are one of the highest risk groups for the swine flu. You can also you cannot give it to people older than 49 years of age, and this is a problem clearly for the elderly as well.
And Dr.
In
Camilleri,
addition, you cannot give a live vaccine.
Let me ask you, Dr. Camilleri.
I was just going to, yes.
Oh, okay, Dr. Kogan, finish your point, because I believe that you are supportive, though, of people getting these vaccines if they fit into the right groups. Is that correct?
Philosophically, I am in favor of a good, high-quality vaccine that's been very well tested in the clinical trials. The vaccine that's coming up to us in October has not been.
All right, Dr. Camilleri, where do you stand on this? Would you get the shot yourself?
Well, no, I would not. I have some serious concerns about this vaccine. Number one, the speed with which this product is being brought to the marketplace is really unprecedented. This will have been the fastest development of a novel human vaccine from the time of development to the time it's brought to the marketplace that we've ever seen in this country. So fast, in fact, that the manufacturers of the vaccine have already been exempted from any liability related to its use. And the reason that they've had to do that is that there simply has not been enough time yet to evaluate the product for safety and for efficacy. And this has happened because the H1N1 virus pandemic has now been declared a public health emergency. And what people need to understand is that when you make a declaration of public health emergency like that, what you're doing is really opening the door to sidestep a lot of the public health concerns and safety measures that would normally be in place anytime there's a development of a novel vaccine for human use, and really that should remain in place for the development of this product so that we can be sure we're getting a safe and effective product to the market.
All right, Dr. Kogan, am I correct in understanding that you had H1N1? And what advice would you give to people who are trying to decide whether or not to vaccinate themselves or their children?
Yes, I have. I'm in a complete agreement here with Dr. Camilleri in San Francisco. This vaccine has only started undergoing clinical trials in late August. We have not had nearly as much clinical data as we need for safety usually. It has not been tested on children. It has not been tested on pregnant women. So even though I wholeheartedly agree that we do need a good quality vaccine, this virus, the virulence of swine flu, up to date, has been proven to be sufficiently low. It gives us time. We can buy ourselves some time to spend money and time on research and provide our people with good clinical trials with underlying safety for this vaccine. The 3.4 million flu shots, not the shots, it's going to be all intranasal vaccine coming to us in October. It's all live vaccine. It's no good for people with immunocompromised system. It's not good for children under 2. It has not been tested on pregnant women and kids at all.
Doctors Kogan and Camilleri, it sounds like you're united in urging some caution over this. We thank you both for your time, and we know there are other medical providers out there who will say, get the shot. I'm sure the debate will continue. We thank you both.
Thank you.